Dr. Zaheer Shah, who is a board certified specialist in internal medicine in Phoenix, Arizona. Dr. Shah, it's great to have you back with us. We've talked about this so many times. Masks work. So it's no wonder that the Biden administration is trying to implement the first 100 days of some sort of a mask mandate policy. But I guess you and I have talked about the politics of this before, which is this isn't just about issuing a mandate. This is about changing an ideology in this country that's stemmed from the leadership. How do you do that?
Well, Kilbini, a picture is worth 1,000 words. The fact that we now have a president-elect who regularly wears a face mask and who advocates for the usage of the face mask, which the science has spoken quite clearly on this, both in the clinical setting as well as in social settings. Social distancing and the usage of face masks prevents the transmission of COVID-19. And now we finally, I believe, are going to have a leader who'll be able to demonstrate that in his own behavior. And as a result of that, hopefully speak to the millions of Americans who may be on the fence about whether or not they ought to be using a face mask.
And Dr. Shah, we keep hearing these warnings about a dark winter ahead in terms of, I guess, the spread of the coronavirus and what Americans need to prepare for before the holiday season. What are you noticing about this second wave?
Well, I mean, second wave or third wave, this is a winter it's not just coming, it has arrived. We are in the midst of a dramatic uptick in the number of cases of COVID-19 being diagnosed across the country. I can tell you that local hospitals here in Phoenix, Arizona, are almost reaching census capacity for their general medical floors with patients that are being diagnosed with COVID-19. I know of one hospital that is contemplating the usage of tents out in the parking lot to accommodate more of the moderately ill patients with COVID-19. So far, our ICUs, I think, are stable in terms of their capacity to carry those that are sicker with the virus. But as this winter continues, as more and more people, due to holiday circumstances and just temperature, are forced to move indoors, socialize indoors, perhaps more than they ought to, we're going to be raising the specter of more death and more human suffering.
Yeah. And Dr. Shah, we've heard from the WHO's Health Emergency Program Director, Dr. Mike Ryan, who's saying that, while vaccines are a very powerful tool in fighting the virus, it's not going to eradicate it completely. What is your feeling right now about the prospects of a vaccine and about the timeline and the rollout needed for that to be a successful part in tackling this pandemic?
Well, this is a very complex issue that involves both supply chain, it involves science, it involves human behavior patterns. I can tell you that as a nation, historically, we've done a pretty good job of rolling out vaccines, whether it's the flu vaccine or others. I can tell you from having been a prescriber of these vaccines that, relatively speaking, the challenges in obtaining them and getting them to the patient, we have pretty well mastered in this country over our time. One of the things that your viewers need to understand about what Dr. Ryan was warning about at the World Health Organization is that merely having the vaccine or even beginning to roll it out and having a substantial number of people get the vaccine doesn't mean that we can all relax and put down our guard. And the reason for that is, let me just give you an example. Measles. Measles is one of the standard vaccines that we've been administering in this country now for decades. In order for us to obtain what we call herd immunity. And let me quickly just define what herd immunity is. Herd immunity is that instance or that set point where we know that enough people have developed antibodies to a particular virus or other agent, that as a result of that, the community at large, those that are most vulnerable amongst us, are not likely to be infected with it. Well, just to give you some sense of what it takes in order to achieve herd immunity, let's talk about, for example, measles. Generally speaking, in order to make a population immune in terms of herd immunity against measles, 95% of that population has to have been vaccinated. Tuberculosis, in order for that, for example, in the instances that we've tried to use vaccines in certain parts of the world, we found that a lower percentage, or polio, I think is a better example. 80% of the population needs to be vaccinated against polio in order for everyone to have the benefits of herd immunity. The challenge here is that this is a novel virus. We've had coronavirus visit us before. In 2002, it came as SARS. In 2012, it came as MERS. These are kissing cousins of SARS-CoV-2, the virus responsible for COVID-19. But we've never been able to develop until now an effective vaccine against it. And we've never, ever contemplated rolling it out to millions upon millions of people. So what will it take in order to confer herd immunity given all of these unknowns and variables? I think it literally is going to be a matter of we're going to have to wait it out and see what that threshold is. When will we achieve that sweet spot where enough Americans, or for that matter, enough citizens of the world, will be vaccinated in order for everyone else to be able to benefit from this notion of herd immunity? Until we have that data, which is hindsight data, it's retrospective data, the best idea, I think, is to remain extremely vigilant, to continue doing social distancing, continue using the face mask. And I think that's what Dr. Ryan is getting to, is that this is not a panacea, this is not a silver bullet. As soon as it becomes available to the general public, it does not mean that this crisis has been averted.
Great examples there, Dr. Shah, and you really bring it full circle back to the masks. We really appreciate your expertise as always. Thanks for that.